Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, this week's question comes from the Twitter crowd, and the question here is, can subcision with CO2 fractional improve my acne scars? Dr. Pane, what would you suggest in this situation?
Yeah, well, for acne scars, you've got a couple of different options. And when you talk about laser for acne scars, that is pretty much the best way to handle it. Now, when you talk about the different options for these scars, you have your fractional CO2 laser and, say, the full CO2 laser. And what's the difference? Well, with fractional CO2, the laser does not picture almost like Swiss cheese. The laser is only getting sort of in the holes of the cheese, not the whole part. And what that means is that your recovery from that procedure is a little less. So your face will get a little pink, sometimes quite a bit pink, depending on what the settings that are used. But there isn't the peeling and all the recovery that goes on with the full resurfacing of CO2 laser. Now, what's the advantage of that? The advantage is you have less of a recovery from each one of the treatments. The disadvantage is that you have to do these treatments, and if they're being honest, they're really about once every 4 to 6 weeks for a minimum about 6 to 8 of them, and sometimes even longer. So you're looking at the better part of a year getting a treatment for when you do Fraxel or fractional CO2. It's not, I don't want to say just Fraxel, because there's a couple different technologies that work the same way. Now, with the full CO2 lasering, it's one procedure. It's a little bit deeper recovery because you have, essentially, it's a controlled, laser does a controlled burn of the top layer of the skin. So picture like a chemical peel, but very precise because it's a laser. Now, the advantage of that is it's one treatment, but you don't have to come back, monthly, but you are peeling for about a week, and you've got to take very good care of the skin, and your skin is going to be pink for a longer period of time. So there's not an exact correct answer. It's a question of, do you want to do multiple treatments over time, or do you want to do one big one, recover, and be done with it, and then you're essentially set? And I think with the CO2, you can get a little bit better work in terms of we think of this with the acne scars as a percentage improvement. It's not going to erase it, take it away completely, but we want to improve it by about 50% or so. And with the CO2 laser, you can do it in a year and a half, 2 years, when the skin has had plenty of time to recover and get even more improvement. So sometimes people will do a second treatment. And again, it depends on what kind of scar you're talking about. Now, subcision, if we look at an acne scar as a depressed area like this, subcision is essentially coming in, and you're dividing this. And then what I like to do is put some fat underneath for these. So you're kind of building up the skin. You want to bring it back to there, if that kind of makes sense. Now, subcision and fat grafting is reasonable. It's not as invasive as the lasers, but it's not going to be as much of a response, because each one of these kinds of scars, there's different kinds of configurations of acne scars. Some scars are actually excised and closed for certain types, but many of them, the broader based ones that have this sort of shoulders, are the ones that we want to level down with the lasers, and some of them are amenable to the subcision and fat grafting. Oftentimes these techniques can be combined. It's kind of a lot to go into. To do a best consult, you want to be seen in person so that you can be examined and have the scars that you have assessed, and then come up with a plan that works for you. But acne scarring is a big topic. It sounds simple, but you can do a lot. But the good news is that almost everybody can get at least some degree of improvement. Depends on what kind of thing you want to go through, what kind of procedure, and what your tolerance for is for recovery and everything like that. So big topic, but we covered a little bit there.
Well, thank you, Dr. Pane. And if you have additional questions for Dr. Pane about acne scar and fractional, please reach out to us on our Facebook page, website, Instagram, or Twitter. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.